So we're asking a really common question today. We get this all the time from
All the
moms who are,
time. Yeah.
every stage of the game. When is the right timeline to have your mommy makeover? When is a good time? Hello, everyone, and welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm Dr. Ashley Amalfi, and I am joined with my co-host, Dr. Smita Ramanathan. We are both board-certified plastic surgeons in the Northeast. Hi, Smita. Welcome.
Hi, Ashley. How are you?
I'm great. So we're so excited. We're answering all these common questions about mommy makeover. And I mean, this is amazing, right? Because mommy makeover is really the most common thing that we do.
Yeah, absolutely, by far the most common thing, which is awesome. I mean, we love it, and I think this is why we're so excited to be doing this series to really educate you guys. So you have some information before you even come in to see us.
Yeah, absolutely. So we're asking a really common question today. We get this all the time from
All
moms
the
who are,
time. Yeah.
every stage of the game. When is the right timeline to have your mommy makeover? When is a good time?
Yeah.
I mean, what's the simple answer to that one, Smita?
I think the simplest answer is you want to wait at least 6 months, after you're done breastfeeding, and really no sooner than 1 year from your pregnancy, right? From when you gave birth. This is important because I think, a lot of my patients, and I'm sure your patients, are so eager to, okay, I'm done having children and I really want to get back to my old self again, or better version of my current self, or whatever the situation is. And they want, I've had patients that are still breastfeeding come into the office and they're like, I'm ready. But it is important. Timing is important, and it does influence your overall results.
Yeah.
So
It's
this is why
okay to
it's important that we
plan.
did this.
I mean,
Yeah,
it's okay to
absolutely.
plan so that when that 1 year hits, we can have a plan ready and we can hit the ground, and your
Mhm.
surgery can be around that time. I mean, we have people who will call the office still pregnant and they're just so eager to get, into the next
Yeah.
stage of life that they're ready to roll. But once you're done breastfeeding, we can take a look at your breasts because they do change a lot, right? So we want to
hmm
assess them when they're at their new normal. But you can see us around that time, 6 months out, and then get on the schedule so that you don't have to wait longer than you want to.
Right.
But the other thing about waiting until the baby's a year is that it just makes the logistics of your recovery a little easier too, because the younger the babies are, the more they really need you, and it's harder for other people
hmm
to jump in and help so that you can adequately recover. But
Yeah.
um, we're all down for planners. So if you guys want to be on the schedule as a first birthday
Yeah.
gift to yourself,
Earlier the
that's
better.
fine.
Exactly.
That's fine. And
Well,
you're not
so
the first and you're not the last.
Yeah, exactly. You'll never be the last. Bill, so what do you tell patients when they come in and, they're actually really eager, they want to get it done? I mean, what are some of the main reasons to wait? Why is it so important to wait? Because there is a reason. It's not because we're being difficult, or there's a reason for it.
The breastfeeding thing, the reason is really infection, because even months and months out from when you've been breastfeeding, pumping, whatever you're doing, if you stimulate the breast, and surgery obviously stimulates the breast, it can still produce milk,
hmm
which is
hmm
wild. And you think it can't happen, but we see patients years out that still have milk in their ducts. And
Right.
it's an infection risk, especially when we're putting an implant in. We want to do everything we can. This is elective surgery, guys. So we want it to be as safe as possible, to control everything we can control. And so controlling milk
hmm
production is just one thing that we can do to keep you safe.
Yeah.
And then how about the timeline for the body, Smita? Why is 1 year a good time limit to kind of get your body where we want it preoperatively?
Yeah, I mean, I think it sort of falls along the same lines that our bodies go through so many changes when it comes to pregnancy, right? You gain weight, our hormones are, there's a lot of hormone changes, but you really want to be at your new stable weight after, before surgery, right? And that takes time. You're not going to sort of get down to your pre-baby weight. And frankly, you might not ever get to your pre-baby weight. It might reset at something new. And so I always say, right, you don't want to operate on a moving target. And so it's really important to sort of have all of your hormones kind of stabilized, your weight at a weight that you can maintain long term. And that's really what's going to give you those long lasting results, right? If we operate and you're still losing weight, well, then your results are going to change also. And that's really, not what we want. We want you to have those results that we can control beforehand so that they last as long as they can.
Yeah. So we want this timeline to be reassuring for you guys so you understand why we're making the recommendations we're making. But, if you are, on your last pregnancy or you just delivered or you're still breastfeeding, it's still okay to call a board certified plastic surgeon, get some information, get a consult on the schedule, and let's get the conversation started. And if you're eager to get it done when you hit these timelines, the 6 months from breastfeeding, the 1 year after delivery, we're happy. We're happy to do this and to get you to your best results. But, just do your homework, find a doctor you trust. You have lots of time to get there. And then you're going to have that new body, that new normal for the rest of your life. So I know it seems like sometimes a long time to wait, but honestly, then, that the new confidence is forever. And so it's absolutely worth doing
the wait.
Safely.
Absolutely. All right. This is a fun one, you guys. We've got many more to come. So make sure you subscribe. You'll find us on YouTube, Spotify, and iHeartRadio. We'll see you guys soon.
Bye, Smita. See you soon, guys.